SLU almost 9 years ago now. I started in August of 2012. I had been born and raised in Chicago and was there all the way until medical school graduation. My husband and I moved out to St. Louis for our residencies and basically expected to be out here for 3 to 4 years and then move right back to Chicago, which was home for us. So here we are almost 17 years later.
Wow.
In St. Louis. So I did my medicine residency and hematology oncology training over at WashU, and then was able to join SLU for my first and only faculty position. At that time, our new division director had come with the vision of building an outpatient transplant program, and so he was looking to recruit and build for that, and so I was able to join at that time, and it's obviously been a very gratifying experience to be able to grow that side of oncology. You know, it's funny, I always feel like I discuss this with a lot of medical students and, you know, even pre-med students, and, you know, this like, how did you end up where you are? I've been fortunate to not really have a very personal experience, meaning a family or a close friend who dealt with blood cancer that kind of steered me in this direction. As cheesy as it sounds, I think as early as junior high and high school, I was kind of just fascinated by blood. I think I saw a bone marrow biopsy done when I was volunteering just to clean rooms at a hospital, you know, and it was very, basically I transitioned into my undergraduate education and was just fascinated by the immune system and immune biology, and I did a few research projects related to that. And I will tell you that even then, it wasn't completely clear to me that I would end up in oncology. But then I got to medical school and I think just became more and more fascinated. It was actually more on the pediatric side, seeing patients with leukemia, seeing these young kids and how sick they got, but then also like how their entire oncology team, their physicians, nurses, pharmacists, social workers, basically everybody pulled together to get them through this intense treatment experience. And then we got to see these young patients early in their treatment journey and then years out doing well. And I think that whole continuum really just definitely sat well with me, because that is how I want my relationships to be. And then so it was that combined with like just the pure medical science interest in blood cancers and manipulating the immune system. So I had set up a few rotations in bone marrow transplant even as early as medical school, and then had a chance to just intensify those experiences in my residency training, stayed on at WashU, and continued to basically be able to just experience blood cancers. I think I liked every single aspect of them, every disease, this idea of being able to manipulate the immune system to do a bone marrow or a stem cell transplant. And then, my gosh, since I graduated fellowship, we've had so many advances in the field that now I actually continue to like it more than I ever thought I would.
Wow.
Yeah. As we got through the first couple months, I think we on the transplant and oncology side were a little pleasantly surprised. We just hadn't really been hit with this first wave. We hadn't seen it in a lot of our patients. And so kind of with the rest of the country and world, we probably started to relax a little bit in terms of moving transplants through, keeping patients on their usual schedule, allowing visitors back in the clinic and in the hospital. And I would say that fall, kind of late October through December, was a huge wake-up call. I think everybody was tired by that point. They were tired of what I think many people refer to as decision-making fatigue, some new COVID-related problem coming up that nobody really had an answer to because we've never dealt with this before. And at that point, we had that second wave that really personally hit our patients. We were diagnosing, I think, easily about 2 to 3 patients a day with COVID. Many of them were able to stay outpatient, but we definitely reached a period of time where a third to half of our inpatient service were COVID positive patients. And they had to be cared for with all the same unique challenges that we kind of take on in a typical oncology patient population. there were many of them who had their cancer treatment put on hold, and we were trying to balance treating COVID while not letting their cancer progress. We unfortunately did lose quite a few patients just because it was pretty much nearly impossible to balance those two problems. So I think as December, early January kind of came around, we were tired. I think morale and just emotions were low because we kind of felt like we were helpless. We just could not prevent this horrible thing from wreaking havoc on our patients. And I will tell you, we kind of got past January. We started to see numbers go down, of course, at least for the healthcare workers, and then the community at large. We started seeing more people vaccinated. February came about and our patients started getting vaccinated. And right now, as we reach the 1-year mark, I mean, this time last year is so crystal clear to me, but I have to say, we are definitely in a better place. We still deal with COVID. We see its effect on our patients, but I will tell you the numbers have gone down. I just think that there's so much more of a comfort level with knowing how to deal with it. I definitely was that person who returned back to work during the first week of the pandemic last year and basically would go home, go straight to my basement, shower, and not let any of my family see me, touch me, do anything.
Yeah.
And I think we've learned over time that isn't necessary. It's still unreal to me, even though we're 1 year into this. I mean, I can't believe it. And I will tell you, I think about this a lot. I think about, what will my kids tell their kids? What will I tell my grandkids about living through this? And as you went, I should say, as I went through it, I thought a lot about what I was fortunate to have. I mean, I was fortunate to have a job. I was fortunate to have a healthy family, to have finances to get me through this. So while it sucked, and I definitely had my low points, I was not as affected as many people that we know out there. And I think if there's anything that this pandemic has taught us all, I do think it's important for us to still focus on the positives, and I mean resilience, and then just learning different ways to do things. I mean, we had to be very reactive versus proactive, but we honestly learned a lot of efficiencies. I don't think that when those of us that are home now, because we've got a cold and we can't expose ourselves to our vulnerable patients, I can still continue a full clinic via telehealth, to see flu rates essentially become non-existent this season with something as simple as just masking makes me think, why did we not do this every single year, especially for those of us that work with vulnerable patients,
Right.
So I guess I would say that I look back and sometimes I kind of laugh at some of these simple things that we've learned, and I just keep thinking, why did it take us a pandemic to figure this out?
Sure.
Yeah.
Yeah.
So there are a few good things that come out of this.